I know receiving a Parkinson diagnosis can feel overwhelming. How are you holding up?
I'm nervous, honestly. I have so many questions. What exactly is Parkinson's disease?
Parkinson's is a progressive neurological disorder that mainly affects your brain and nervous system. It happens when brain nerve cells in a region called substantia and nigra break down or die. These cells produce dopamine, a chemical messenger essential for smooth, coordinated movement. When dopamine levels drop, movement becomes impaired.
That makes sense, but do we know what causes those cells to die?
We don't fully know. It appears to result from a mix of factors such as inherited genes mutations, though most arise from a combination of genetics and environment.
So, what symptoms should I expect?
Parkinson's is broken into early and late stages. In early stage, mild symptoms may present. In late stage, motor symptoms have developed further with more limitations in day-to-day life. The three main motor symptoms of Parkinson's disease affects your physical movement are tremors, stiffness, and slowness of movement. With tremors, it involves shaking, especially when resting. It often starts in one hand or arm rather than both. With stiffness, rigid muscles can make it harder to turn over in bed, get out of a chair, do up buttons, etc. Stiffness can also affect your posture, facial expressions, and leads to aches in muscles. With slowness of movement or bradykinesia, it can be hard to start a movement or it may take you longer to do a task. This can also affect repetitive movements like handwriting and getting dressed. You may also experience a range of non-motor symptoms such as depression, anxiety, loss of interest in life, disturbance of normal sleep, extreme tiredness, lack of sense of smell, constipation, trouble swallowing or speaking, skin sensations, and pain.
That matches some of what I've been experiencing. What about treatments? What options are there?
There's currently no cure for Parkinson's. Treatments are available to help reduce symptoms and maintain quality of life for as long as possible. These include supportive therapies like physiotherapy for strength, flexibility, and balance, occupational therapies to help with daily tasks, deep brain stimulations, and medication. If you have mild symptoms of Parkinson's, your doctor might not recommend medication. Instead, focus on supportive therapy and lifestyle improvements like exercise and relaxations to help mobility and mood. Healthy diet, high in fiber and fluids, supports digestion and overall health. As your symptoms progress, you may be prescribed medication. Examples of medicines for Parkinson's include levodopa plus benzodiazide, ropinirole, and amantadine.
That was so helpful. Follow Selenethenurse to learn more about your health.